Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order and this is quite convenient for the study. You can also make use of it. In the last class we have been discussing about some of the important MCQs related to Kashyapa Samhita. So today also we will continue the same. So today we will deal with the next question, that is, which of the following is true regarding dentition? We know that dentition, Danta Janma, has been explained as a separate chapter in Kashyapa Samhita for the first time. So we have got another question from the same chapter. Which of the following is true regarding dentition? Kathina and Sthira Danta are seen in male child. Sushira and Mrudhu Danta are seen in female child. In both sexes, danta are of equal nature. In female, dentition is faster. Now, which of the following is true regarding the dentition? Okay, this is the question. Which of the following is true? Kathina and Sthira danta are seen in male. Yes, this is the right answer. This is true. And Sushira and Mrudu danta are seen in female child. Yes, this is also true. In female, the dentition is faster. This is also true. But the C answer, in both sexes, danta are of equal nature in both sexes. This is wrong because male and female, Mrudhu and Sushira, Kathina and Sthira, these are the nature. That's the reason in case of male, the dentition is quite difficult, or dentition is quite painful and a discomforting phenomena in case of male, whereas dentition is quite easier and faster in case of female. The reason is, in case of the female, the danta are more sushira, hollowness, and mrudu, also soft. So here the question asked is, which of the following is true regarding dentition? Actually all the three are true and only one is false. The answer C is false. This question should be framed in a different way. Which of the following is not true regarding dentition? If you make it as question as which is not true, then in both sexes danta are of equal nature. This statement is not true. So this is the question number 43. We'll move on to the next question. As for Kashyapa Samhita, danta nishekha or insemination starts at which month? See, nishekha is one embryologically taking place, intrauterine life. The tooth buds are formed, or the buds are formed in a very rudimentary form. So even Kashyapa is mentioning about the changes which are taking place in the intrauterine life also. See, in those days, without use of any ultrasounds and all those things, he is able to identify that in which particular month of the intrauterine life the dentition tooth buds are formed. Chaturte maase danta nishiktho bhavati. This is what is told. Okay, so question is, as for Kashyapa Samhita, danta nisheka or insemination start at which month? 7th month of intrauterine month, 3rd intrauterine month, 4th intrauterine month, or 6th intrauterine month? As I told, Chaturte masi danta nishikto bhavati. Kashyapa very clearly says, in the 4th month of the pregnancy, that is in the 4th month of the intrauterine life of the fetus, the insemination or nishekha of the tooth buds start in the gum area or in the jaw area. It's very clearly told. So answer is 4th intrauterine month. Come to the next question. Agni becomes very unstable at which stage of the bala? Is it in the Kshirada Avastha? Is it in the Kshira Annada Avastha, or Kumara Avastha? Agni or digestive power or metabolism is very, very unstable. Sometimes the metabolism is good, sometimes the metabolism is not so good. Sometimes child is eating well, sometimes child is not eating well. So such kind of presentation will be seen at which particular stage of the pediatric age group. Is it in the Kshirada, that is in the first year, Kshira Annada 1 to 2 years, Annada, or Kumara Avastha? So if you know the answer, Kshirada is not the correct answer, Annada is also not the correct answer, Kumara is also not correct answer. The left one is Kshira Annada. Kshira Annadasyaha aniyamatoho agnihi. So Agni is very stable, very unstable. Okay, sometime It is good, sometimes it is bad, like that. So it is in Kshira Annadavastha where Agni is very, very unstable. Aniyamita, Aniyata of the Agni. Okay, so correct answer is Kshira Annadavastha. Go to the next question. Clerk's rule is for calculation of the dose of the medicine based on. Now we have got in the dosage form or in Aushadhi Matra Nirdharana. So we usually use Clerk's rule for the calculation of the dose of the medicine. And here the question is, Clerk's rule is for the calculation of the dose of the medicine, right? But it is based on which particular factor? It is based on the height. Is it based on the weight? Is it based on the surface area, or is it based on none? Okay, so Clerk's rule says that adult dose into weight in kg divided by 60. Okay, this is a Clerk's rule. So here weight. So answer is weight. So Clerk's rule can be used for the calculation of the dose of the medicine in children based on the weight of the child. Based on the weight of the child. And we know that the formula is the dose is equal to adult dose into weight in kgs divided by 60. Go to the next question. Young's formula for the calculation of the dose is based on which particular factor? Is it height, weight, surface area, or age? Okay, so Young's formula is another important formula which is used for the calculation of the dose. And Young's formula says that dose is equal to adult dose into age divided by age plus 12. Divided by age plus 12. This is the formula. So as the age is mentioned, so Young's formula basically formulated on the basis of the age of the child. In a particular age, what should be the dose of the medicine? Then you can go for Young's formula. In a child with a particular weight, what should be the dose of the medicine? You can go for the Clerk's formula. So next question is calculation of the surface area for the calculation of the dose is most reliable in. Now we have also got a method of calculating the surface area based dose. Okay, so dose can be also estimated based on the surface area. Now, so surface area will be sometime more, sometime less. So based on that we have to calculate the dose. So question is calculation of the surface area for the calculation of the dose of the medicine in children is most reliable in which of the following condition? In PM, in obesity, tuberculosis, and dehydration. Okay, so there are some conditions where the surface area will be more, weight may be less, age of the child may not be predictable. So what is the formula for the surface area? Yes, 4 into weight plus 7 divided by weight plus 90. 4 into weight plus 7 divided by weight plus 90. So this is for the where weight means body weight, okay, in kgs, body weight in kgs. So this is the formula. Now this is quite useful in case of PEM, especially PEM, protein energy malnutrition. When you calculate the dose for the child, it is better to not go by age, not go by weight. It is better to go by surface area method. Okay. Now the word matra tasya kaniyasi is mentioned by which author? Okay, is it by Charaka, is it by Ashtanga Hridaya, Ashtanga Sangraha, or Kashyapa? So now first of all we should know where actually this word comes. Matra tasya kaniyasi. Dosha dusha malaschaiva mahatam vyadayeshe tayeva sarve roghanam matra tasya taye sarve bolanam matra tasya kaniyasi. That means, so this shloka is basically mentioned by which author? Then you find the answer for this question. So who mentioned this shloka? Dosha dusha malaschaiva mahatam vyadayeshe ta eva sarve balanam matra tu alpataramataha. Okay, so this is told by Charaka. Okay, ta eva sarve balanam matra tu alpataramataha. The question is matra tasya kaniyasi. Is it by Charaka, is it by Ashtanga Hridaya, is it by Ashtanga Sangraha, or is it by Kashyapa? So this is the question. I leave this question for you. Okay, is it by Charaka, Ashtanga Hridaya, or Ashtanga Sangraha, or Kashyapa? You have to identify that. Okay, Matra Tasya Kaniyasi. There may be a similar shloka in different samhitas, other samhitas also, giving the same meaning, but here we are going by particular word. Matra Tasya Kaniyasi. Okay, so next question is concept of Swatantra Vritti Bala and Paratantra Vritti Bala has been given for the first time by dash. Swatantra Vritti Bala and Paratantra Vritti Bala. Okay, is it by Chakrapani? Is it by Ashtanga Sangraha, Ashtanga Hridaya, or Kashyapa? Now, Nivrittir Vamanadinam Mrudutvam Paratantratam. When you talk about the contraindications of Panchakarma and all in children, there they says Nivritti Vamanadhinam Mrudutvam Paratantratam. In Paratantra child, you should not go for Vamanadi karmas. Nivrittir Vamanadhinam Mrudutvam Paratantra, because child is very, very delicate and not tolerable to the stress. So therefore this is Paratantra Bala. Those kids who are depending on other for their day-to-day activities, you should not perform any Vamanadi karmas. Okay, so commenting on this, there is a detailed explanation of what do you mean by Paratantra Bala and what do you mean by Swatantra Bala. The question is, this concept of Swatantra Bala and Paratantra Bala has been mentioned for the first time by which author? Chakrapani, Ashtanga Hridaya, Ashtanga Sangraha, and Kashyapa. The answer is Chakrapani, because Nivrittir Vamanadinam Mrudutvam Paratantratam Vak Cheshtur Asamartyam Viksha Baleshu Shastravit. This shloka is given by Charaka. Okay, commenting on Charaka shlokas, Chakrapani says, what do you mean by Swatantra Vritti Bala? What do you mean by Paratantra Vritti Bala? Okay, so answer is a Chakrapani. Okay, Chakrapani is the right answer. So this is all for today. In the next class again we will continue with some of the important MCQs. And now you need to find one answer for this. The word Matra Tasya Kaniyasi is mentioned by which author? Is it by Charaka, Ashtanga Hridaya, Ashtanga Sangraha, and Kashyapa? Because it's similar. Matra to Alpatara Mata is mentioned by Charaka. Okay, thank you very much. Again we will meet in the next class. Don't forget to subscribe to the channel and also please give me the valuable comments. Thank you.